Welcome back to the Gluten Free RN podcast. I'm Nadine Gruskowiak, the Gluten Free RN. Today, during episode 31, we're going to talk to specifically healthcare providers. And who is a healthcare provider? Well, anybody that provides care for patients or clients. They can be nurses, nurse practitioners, MDs, DOs, naturopaths, massage therapists, anybody that actually has contact with people that pay them for their health care or to feel better. That can take many different roles. So today we're going to talk very specifically to those healthcare providers, but the rest of you are more than welcome to listen in. Welcome back to the Gluten Free RN podcast. I'm Nadine Gruskowiak, RN, BSN, CEN, also known as the Gluten Free RN, for over 10 years now. And over those 10 years, I've learned a lot about non-celiac gluten sensitivity and celiac disease. I've taught many classes to healthcare providers, some of them over 8 hours long, and several dozen classes that have been an hour or two or half a day. If you're ever interested in having me come in and talk to your physician group or your hospital or any of your clinic employees about celiac disease, please just contact me. I have given over 2,000 lectures on every topic that surrounds celiac disease and non-celiac gluten sensitivity, and as an expert in celiac disease, I love to share that knowledge. So today I am speaking specifically to healthcare providers, but please listen in because what I'm going to talk about today is the standard of care for patients with celiac disease and non-celiac gluten sensitivity. And for those providers out there that are listening, I would like to ask, how many of your patients have you diagnosed with non-celiac gluten sensitivity or celiac disease? It should at least be 1% of your population or your clinic or your patients that have celiac disease, at least 1%. And I can assure you that number should be higher. Many cases of celiac disease that you find in your clinic, well, then the rest of the families will get tested and they themselves will have celiac disease also because celiac disease is genetic. Unfortunately, I've heard a lot of healthcare providers refer to celiac disease or gluten intolerance or non-celiac gluten sensitivity as a fad, but really we should all be looking at it as an epidemic. Anybody in the healthcare field should be looking at celiac disease as an undiagnosed epidemic. For over 70 years, celiac disease did not get diagnosed in this country, in the United States. And so we're having to overcome that. We're actually having to really work hard at finding the people with non-celiac gluten sensitivity and celiac disease so we can prevent pain and suffering, because that is our role as healthcare providers, is to help people feel better. Just a couple quick questions, and we'll come back to these at the end. True or false? Diarrhea is the most common symptom of celiac disease. 2, patients with celiac disease are underweight. 3, gluten must be ingested to affect a celiac patient. And 4, celiac patients should be on a low-fat diet. Those are all true or false questions, and we will come back to those at the end. I'd like to remind everybody that I am a nurse. I have a BSN, and my history is I used to work in the emergency departments all over the state of Oregon as an agency nurse. I did that for 17 years. I was also a trained trauma nurse and critical care nurse. So my background is pretty expansive, and I love the challenge of celiac disease. I love the fact that it is so diverse and each person presents somewhat differently, and each person has obstacles or challenges they have to overcome as they heal from celiac disease. As a nurse, I don't diagnose or order tests to diagnose for celiac disease, but I do have practitioners that send me lab work and patients all of the time so that we can review the lab work appropriately and make sure people get the correct information. So I am a celiac educator. I also run a business called Celiac Nurse Consulting, and that part of my business actually works with facilities such as hospitals, prisons, education systems such as elementary schools or colleges, universities, Since the people with celiac disease are actually protected under the ADA or Americans with Disabilities Act, we want to make sure that everybody is compliant with that so that people with celiac disease are offered the same services and safe food that everybody else on the campus or in hospitals or in universities or in the prison system that everybody else has access to. Again, it's all about safety and compliance with the ADA, Americans with Disabilities Act. And I appreciate people that are skeptical. I appreciate people that are questioning and always have really good arguments about, why people should be on or shouldn't be on a gluten-free diet, but always demand evidence and think critically. Those are very important skills. And I highly recommend that anybody that wants to talk about celiac disease or non-celiac gluten sensitivity do a little research and then come talk to me. I'm more than happy to answer any questions and also to have a debate about why celiac disease is very underdiagnosed or undiagnosed in some cases. In vast areas of the world, celiac disease is still not recognized as a disease or as a syndrome or as an intolerance to a food, and that food being wheat, barley, rye, and oats. So I highly recommend that people are skeptical, but look at the evidence, think critically, do your own research, and then come talk to me. But we do see celiac disease a lot in the media. We see gluten-free diets everywhere, and a lot of the media is dissuading people from being on a gluten-free diet. And I always tell my patients, and I tell the people that I give lectures to, please pay attention to who is advertising in that media form, whether it's print or TV, in a movie or a TV show. Please pay attention to who the sponsors are or who is advertising in that show, because those advertisers actually have a fair amount of influence on what gets said or printed and how the gluten-free diet is presented. Some of the headlines I've seen are gluten-free diet, bad for gut health, gluten-free diets, more harm than good, gluten-free, friend or fad. And from a physician, I heard, stop punishing your child by not letting him eat gluten. So I really do want to make sure that people know that celiac disease is a bona fide, real, honest-to-goodness disease that is caused by people eating gluten. And so if people actually feel better on a gluten-free diet, we need to support that. And I'll explain more about why. I know a lot about the history of celiac disease, and I certainly know that there were dozens of articles about celiac disease in the New York Times, mostly up until 1952-ish. There was a great article in the New York Times published May 21st, 1950, and the gist of the article was that 60 years ago, celiac disease was incurable and often even fatal. Today, in 1950, cures are certain in over 90% of the cases, and deaths are rare. I would say that in 1950, that was probably true for children, because we used to think that celiac disease was a childhood disease and that children grew out of it. We no longer think that at all, and we know that people have to be 100% on a gluten-free diet for the rest of their lives, which is great. And believe it or not, very easy. This does not have to be hard. And when people make it hard, I tell them they are doing it wrong. They really do just need to talk to somebody that knows what a true gluten-free, dairy-free diet looks like, and or a paleo diet, which is much simpler than even trying to be on a gluten-free diet. In a great article by Dr. Fasano in 1996, it's included in the references, "Where have all the American celiacs gone?" Dr. Fasano actually asked that question since he's a pediatric gastroenterologist that came to the United States. And he looked around and he said, "Hey, where are all the celiac patients?" And our doctors here in the United States basically said, "We don't have any celiac disease here." And Dr. Fasano was like, "Wait, it's genetic. Where did they all go?" And our doctors are adamant, and they're still adamant to this day to a large extent, that there is no celiac disease in America. And nothing could be further from the truth. In 2004, the NIH had a consensus meeting, And what they discussed was celiac disease. And in that consensus statement, they discussed two things primarily. Those two things being doing a mass screening of everybody in the United States for celiac disease, because celiac disease meets the WHO criteria, which is the World Health Organization criteria for a mass screening. At that same meeting in 2004, they also discussed education programs for healthcare providers regarding non-celiac gluten sensitivity and celiac disease. And I ask all of the time, whenever I give a talk or a lecture, I say, how many of you got mass screened in 2004? How many of you were educated in 2004 about celiac disease? And many of the people don't actually raise their hands until I say, for how many of you is this the first time you're having education about celiac disease or have heard that celiac disease meets the WHO criteria for mass screening? And virtually everybody raises their hand. Now, there are certain components of people that I've given lectures to that are very well educated about celiac disease. They've learned about it typically on their own or have heard about it in a conference, listened to speakers, and then done their own research. And I highly recommend that. But as of this date, the United States still has not done a mass screening, nor have they instituted an education program for celiac disease for healthcare providers. And the criteria for a mass screening, according to WHO, are early clinical detection is essential, the condition is common, screening tests are highly sensitive and specific, effective treatment is available, and untreated celiac disease does lead to many, many, many complications. So celiac disease meets that WHO criteria. If we can just identify, recognize, treat people for celiac disease, a lot of the complications either will go away or people will go into remission, and we are dealing with preventative medicine at this point. So a gluten-free diet is preventative for many other healthcare issues, especially any other autoimmune issue. Since celiac disease is considered at this point to be an autoimmune disease, anybody with an autoimmune disease is at a 30 to 50% greater chance of developing another autoimmune disease. And those include things like MS, type 1 diabetes, lupus, rheumatoid arthritis, Sjogren's disease, vitiligo, and the list goes on and on. The definition of celiac disease, according to the World Health Organization, is as follows. Celiac disease is characterized by hypersensitivity to gluten, a cereal grain storage protein. The prevalence of clinically diagnosed celiac disease is estimated to be 1 in 1,000. However, screening trials suggest a prevalence of up to 1 in 100. The gluten-sensitive enteropathy results in weight loss, diarrhea, symptoms due to nutritional deficiencies such as anemia, fatigue, and growth failure. These symptoms are the result of the mucosal lesions that develop and eventually result in villus atrophy. Celiac disease may also present as extraintestinal manifestations such as dermatitis herpetiformis or may remain clinically silent. So there's a number of things that we'll talk about because not everybody has symptoms. That's why celiac disease has to be on every differential diagnosis. I used to tell people that I wanted them tested for celiac disease every time they went into the doctor's office unless they went in for a hangnail. And I no longer say that. Even if people have hangnails, that's a nutritional deficiency. In reality, everyone should be tested for celiac disease. And honestly, almost every time they go in to see the doctor, because no one can be ruled out for celiac disease with just one test. And I hear that all of the time is that doctors test people for celiac disease and people come to me and they say, well, I was tested for celiac disease, but I don't have it. Well, we really need to understand as practitioners that celiac disease can be triggered at any point in a person's life, especially those that are predisposed for celiac disease genetically as carriers of the HLA-DQ2 and or DQ8 genes. So a good place to start is to find out if your patients are HLA, DQ2, and or DQ8 gene carriers. That is valuable information. And it's very important to note that even if people are not carriers of HLA, DQ2, and or DQ8 genes, they are still at risk for non-celiac gluten sensitivity or damage from the grains, from exposure to wheat, barley, rye, and oats. So celiac disease is genetic, and the genes that are associated with celiac disease would be the HLA, DQ2, and or DQ8 genes, and that's an easy test to order for people. Even children can have that test. It's just a cheek swab, can be a blood test, but there's also an environmental component. It's the quality and the quantity of the grains that we're exposed to every day. So grains tend to be in our food products and things that we use daily for our personal care. We are exposed to grains on a very high level, and it's not very surprising that our bodies react to them. So celiac disease is chronic. It never goes away, despite the fact that they used to tell children that they would grow out of celiac disease. It is 100% lifelong gluten-free diet at the very least. It is considered to be an autoimmune issue. So as I said before, once you have one autoimmune disease, the chance of developing another one is 30 to 50% greater. And I always encourage people to collect other things other than autoimmune diseases. Please collect things like Beanie Babies or shiny rocks or something other than autoimmune diseases, because as we know as practitioners, that autoimmune diseases will kill people. You can take medication to go into remission, you can do things to treat people, but at this point, we really need to look at the diet and make sure that we're treating people appropriately. Many people with celiac disease, once they at the very least a gluten-free diet, if not some form of a paleo diet, many of their autoimmune issues abate or go away or resolve. In the United States, celiac disease is considered to be a digestive disorder, which means that the doctors are primarily looking for that villus atrophy. What other practitioners know is that celiac disease is primarily neurological, which means that it impacts the neurological system at a higher percentage than even the digestive system. So people with neurological symptoms will present with things like seizures, neuropathies, or numbness and tingling in their hands or their feet, or in different patches of numbness in their body somewhere. Constipation can be a neurological symptom. Falling or MS-like symptoms can also be a symptom of celiac disease. And of course, celiac cerebellar ataxia, where people just can't walk straight. Their proprioception is off. They have a hard time standing up straight or walking straight. They might be clumsy or walk into walls. That's a neurological issue, and it's sometimes very directly associated with celiac disease. Skin is a major component of celiac disease, especially if people have dermatitis herpetiformis, or DH. Whatever's going on in your skin is a direct manifestation of what's going on internally. Unless you have things like poison oak or a bug bite or some type of thing like that your skin is reacting to topically, if you have a chronic rash or blisters or eczema or any type of thing, the inside of your body typically looks the same or is dealing with the same type of inflammatory process. Your epithelial skin is the same tissue that is in the inside of your body also. So epithelial tissue is not just your skin, but it makes up many different components of your body. So if your skin looks like that, so does the inside of your body and many of your organs. So the villus atrophy can lead to malabsorption, and once you have malabsorption of nutrients, many different things can happen. Certainly we know about scurvy and rickets and a couple other things. But then once those proteins are capable of getting into your bloodstream due to the damage in the small intestine, those proteins will wreak havoc on every organ in your body. That's why it's multi-system, because those proteins, those long chain amino acid proteins that are 33 mer long, that are then in your bloodstream, they will wreak havoc on every organ in your body. And the interesting thing is, if you have a leaky gut or increased permeability of your intestinal wall, then you don't just have a leaky gut. You also have a leaky blood-brain barrier, leaky vessels, leaky blood vessels, leaky lungs, and leaky skin. It's all epithelial tissue. At this point, I'd just like to go over really quickly what a gluten grain is, or what grains contain gluten. So there's wheat, barley, rye, and I also include oats, and we'll talk about that. It's any component of wheat, which includes spelt, seitan, seminola, couscous, durum, kamut, bulgur, farina, emmer, gram, and the list goes on. And I really don't care if they're sprouted or soaked. It doesn't matter. Those proteins are still there. And the same thing goes for sourdough. People with celiac disease should not be eating any component of these grains. Barley is typically used as a malt or a sweetener, so you have to be very cautious about that one. I've started to see barley in many different things that I never expected I would see barley in, such as hummus and in a kombucha. Who puts barley in a kombucha? So those of us that are still reading labels and trying to be extremely healthy and maintain our gluten-free diet have to be very cautious about buying any product. Rye, and then the oats. And the oats is a cross-contamination issue. It's the field they're grown in, the silos they're stored in, the trains they're transported in, and the facilities they're processed in. So if there's any opportunity for cross-contamination, then oats are out. Thankfully, there's 6 to 7 companies between the United States and Canada that produce certified gluten-free oats. One of my favorites is from Montana Gluten Free. They actually have the best oats, and they are certified gluten-free by the GFCO. Please keep in mind that celiac disease is a medical issue, but it's also social, political, and economic. When doctors did look for celiac disease, or when they still do look for celiac disease, unfortunately, they look for the classic celiac disease. If they were taught about celiac disease at all, they were taught that it was chronic diarrhea, malabsorption, extreme weight loss, and malnutrition. I still have people, after I give lectures, send me pictures of children that have the big bloated belly and the stick arms and legs and the droopy butt. And they say, "What do you think?" And I say, "Actually, what do you think?" Because these children are very obviously in need of getting tested for celiac disease because they are starving due to the damaged villi in the small intestine. This is primarily for the pediatricians, and this is celiac disease in children. Now, if you're a family practice doctor, you also need to know this information because celiac disease can show up in many different ways in children. I see many children in my office, and it's very best if we can find women before they get pregnant and get them on a gluten-free diet before they have children. But in the case that we haven't identified those kids yet, we need to really find them early because the longer we wait for these kids, the more likely they are to develop other autoimmune diseases, especially type 1 diabetes. So these kids can present with diarrhea and or constipation, general abdominal pain, failure to thrive or falling off the growth chart, short stature. Even if the rest of the family is short, we still want to make sure that the entire family doesn't have celiac disease because it is genetic. Any learning disability, ADHD, ADD, ODD, autism, skin issues such as eczema or psoriasis or acne, especially before they're treated with any antibiotic, delayed puberty. I have some children in my office that have not had their period or developed sexually, and they're 17, 18, 19, and I just heard of another gal the other day that didn't get her period until she was 21. Dental problems, so dentists should be looking for celiac disease in the form of dental enamel defects, difficulty swallowing, glossitis, cavities, sensitive teeth, and bleeding gums. Those bleeding gums or nosebleeds that typically go along with the bleeding gums can be potentially a vitamin K deficiency, anorexia and or obesity, Anybody with anorexia nervosa or any eating disorders certainly should be tested for celiac disease. And just because a person is overweight does not exclude them from celiac disease. Those people are starving also. And bedwetting. If children or adults are bedwetting, there's a good chance they have interstitial cystitis in the absence of a urinary tract infection, especially if they're chronically bedwetting. What that means is the lining of the bladder is inflamed, and until we make that inflammation go away, then they're going to continue to bedwet. So it's not a behavioral issue all of the time. It could, in fact, be a very physical symptom that they have interstitial cystitis or inflammation of the bladder lining. I also make a point in my elderly population to get them tested every year for celiac disease. You would be astounded at how many people I've found with celiac disease in the older population. And the NFCA, which is the National Foundation for Celiac Awareness, has stated that 30% of the people that get diagnosed with celiac disease are over the age of 60. So please make sure that you are testing your people for celiac disease. Don't assume that their bodies are supposed to fall apart as we get older. I had a gentleman who was very sweet and very health conscious. He was 99 years old, and he said, if this diet's going to make me feel better, I'm going to do it. So please give people the option and make sure that they know that there is a chance that they could feel better. And people always need that option of having a higher quality of life. They need to know that sometimes, even in the absence of a positive celiac panel, that going on a gluten-free diet may alleviate some of their symptoms. And what I look for in the elderly population are anybody with dementia or diagnosed with Alzheimer's disease, vision and or hearing loss, urinary problems such as incontinence, again, that interstitial cystitis, a diagnosis of cancer, especially bowel cancer, ataxia. Again, that's the celiac cerebellar ataxia where people can't walk straight. So if they need a cane or a walker or they fall a lot, I highly encourage that you test your patients for celiac disease. Arthritis, hair loss, and that goes for men and women. So alopecia areata, fatigue, osteoporosis, and anemia. So if a man has osteoporosis and anemia, he has celiac disease until proven otherwise. What we're looking for is a healthy intestinal lining. But what happens in the presence of gluten or wheat, barley, rye, and oats primarily is the villi get inflamed, they start to bend over, they fold over, they blunt and atrophy. Those tight junctions open up, and we end up with a situation where all of those villi are gone, and that damage can be patchy. The lamina propria swells or gets edematous, and then it looks like a sponge. Quite frankly, if instead of a very healthy coral reef or pink shag carpeting, as we like to refer to it as, it looks like a very inflamed sponge. And that sponge is allowing many different things to get through into your bloodstream, such as toxins, heavy metals, undigested food particles, including the long-chain amino acid protein of the gluten, yeast and fungus, parasites, and other harmful bacteria. So the goal should be to heal up that leaky gut, have the intestines regenerate, and that does take about 6 months to a year in the absence of gluten. So people have to be 100% strictly on a gluten-free diet at least. Some variation of a paleo diet is necessary for many of my people that are chronically ill, or I get them out of ICUs, and I have to get them better faster. So I will put them on some variation of a paleo type diet or a whole food diet. They get better faster. A review of some of the top symptoms that people present with would be chronic anemia and fatigue, muscle and joint pain, depression and irritability, thyroid disorders, and that's any thyroid disorder. Typically, in the absence of gluten, thyroid disorders will resolve. So unless the thyroid is taken out or ablated, there's a good chance the thyroid will start functioning appropriately. Any infertility issue, whether you're a man or a woman, In Finland, if you have any issue with infertility, the number one thing they test you for is celiac disease. We don't do that in the United States yet, but hopefully soon. So anybody you know that has an infertility issue, again, whether they're a man or a woman, should be tested for celiac disease. Any GI problem from your mouth to your rectum. So any difficulty swallowing, problems with sores in your mouth, canker sores, GERD, peptic ulcers, gastroparesis, any type of GI problem, Crohn's, colitis, ulcerative colitis, diverticulitis, hemorrhoids. In the absence of gluten, a lot of people's hemorrhoids go away. It's miraculous sometimes, but it's that inflammation of the tissue. You cannot separate out the small intestine from the rest of the intestinal tract. You just can't do it. So the gluten actually impacts every component of the GI system, not just the small intestine. Migraine headaches, psychiatric disorders, and I do give an 8-hour lecture on the mental health component of celiac disease. It's enormous. And I love it when people's seizures go away. They resolve on a gluten-free diet. And I've heard multiple stories of people that have been really good on a gluten-free diet, and they get just the minutest exposure to gluten, and suddenly they're having seizures. So do keep in mind that gluten is a neurotoxin, and it can cause seizures. So we want to have a high index of suspicion for just about everyone that comes into our office, if not everyone, whatever they come in with, to make sure that they are being tested appropriately for celiac disease, especially if they have skin issues. Dermatitis herpetiformis can be very itchy and painful. It can be misdiagnosed as many different things. Even as a nurse who is very well educated and read every dermatology book that I could get my hands on, what I know now is that celiac disease and dermatitis herpetiformis are misrepresented in every derm book I've ever read. So have a high index of suspicion for everybody in your practice. Your skin is your largest organ, and this is from the American College of Gastroenterology from 2011. Gluten-containing cosmetics can be inadvertently obtained by the consumer, and use of these products can result in an exacerbation of celiac disease. So that's not even from the American College of Dermatology. That's from the American College of Gastroenterology in 2011. So it does absolutely matter what you put on your skin. So be very cautious of that. And do remember to keep celiac disease in the differential diagnosis from everybody that has any skin issues, any autoimmune diseases, anybody with Down's, Turner's, or Williams syndrome, anybody with cardiomyopathy, and the list goes on. There are other gut disturbances that cause brain disturbances, such as food allergies and intolerances, medications that people are taking, parasites and other pathogens, digestive enzyme deficiencies, stomach acid problems such as achlorhydria or hypochlorhydria. So really you need to test anybody that's been on a proton pump inhibitor or H2 blocker. Those medications can actually cause people not to be able to absorb nutrients appropriately. And bacterial imbalances or SIBO, small intestinal bacterial overgrowths, and dysbiosis. That intestinal permeability or leaky gut, and excessive prolonged stress can also cause problems. The effects of gluten on the brain are very well documented. They can cause people to be angry, have depression and anxiety, learning disabilities or disorders. We've had many children that have been on IEP plans or individual education plans, and now they're doing advanced placement, math and science, and tutoring. I encourage everybody to get their brains back and use them to the highest potential. But many people are having lethargy or low energy, difficulty sleeping or insomnia, brain fog at the very least, and at the other end, schizophrenia. Dyslexia is also implicated as a sign or symptom of celiac disease. And it is really important that we find the people with the neurological components of celiac disease also, because as Dr. Hadjifasiliou has noted numerous times, the neurological component of celiac disease will kill people also if it's not treated appropriately, with a gluten-free diet at least. and it takes longer to heal the neurological system, but we all do have neuroplasticity, and we need to work on getting the healthiest nervous system that we can. And the way we do that is typically with a super good high-fat diet and at least a gluten-free diet, if not some form of a whole food diet, also referred to as a paleo diet. Who's affected? Just so you know, celiac disease does not discriminate. It can be any age, any race, or gender. And celiac disease is considered to be primarily a disorder for females, but the reality is it's 1-to-1. For every female that's diagnosed, there is at least 3 to 5 men out there that have not been tested or diagnosed. So more females are diagnosed, but it doesn't mean that just as many men are affected. And we know that from the pediatric population. Celiac disease at this point is estimated to affect at least 3 million people. 99.9% of those Americans are undiagnosed. And unless you live in Finland or a place where there's universal health care and people are getting actively tested, then we really need to keep celiac disease on the top of the differential diagnosis list, not the bottom. I don't want to hear anymore that somebody was in the ICU on a ventilator and they were critically ill and they had tested them for everything and they couldn't figure out what was wrong with them. And then lo and behold, they test for celiac disease and come to find out that poor patient is actually celiac. So that's not the correct way to do it. It actually should be the first test that is done. And let's try to keep people out of the ICUs and practice preventative medicine. It's estimated currently that at least 1 out of 7 Americans, or 43 million Americans, suffer from non-celiac gluten sensitivity. We may see those numbers go up higher. And do keep in mind that all it takes is a breadcrumb to trigger the same autoimmune response that a full piece of bread or a piece of cake will cause. A breadcrumb, a dusting of flour. That's why people have to be very, very, very careful about cross-contamination, because it does not take very much of the gluten protein to cause a systemic reaction. Some people get symptoms right away. Some people have a delayed reaction. It doesn't mean that that damage isn't occurring on a very cellular level. And as Hippocrates said, all diseases start in the gut. All diseases start in the gut. We need to remember that. We need to look deeply into the intestines and then outward and start healing the intestines and see what else gets healed in the process. There's a great article entitled Economic Benefits of Increased Diagnosis of Celiac Disease in a National Managed Care Population in the United States. And what is notable in that article is that the atypical non-diarrheal presentations are now the most frequent. Celiac disease is grossly underdiagnosed in the United States. The average delay in diagnosis for adult patients with celiac disease ranges from 4 to 11 years in North America, and diagnosis and treatment with gluten-free diet leads to improvement in quality of life, even in those asymptomatic at diagnosis. That's a very potent article, and I will include that in the podcast notes as a reference. I'm also including the article that says celiac disease could be a frequent disease in Mexico, prevalence of tissue transglutaminase antibodies in healthy blood donors. The overall prevalence was 1 in 37. For women, it was 1 in 33. For men, it was 1 in 40. So this shows a much higher prevalence of celiac disease in Mexico City in healthy blood donors. So please keep in mind that people don't have to be Northern European, that this is a worldwide health epidemic, and it is a public health crisis, and I do want you to be aware of that. So don't exclude testing people because they're African American or from Africa or Mexican or Latin American, wherever they're from. Please keep a high index of suspicion. From Asia, Australia, anywhere in Europe, of course, and the Americas. Even in the Middle East, it's noted that even though that's where the Fertile Crescent is and grains actually came from. Celiac disease in the Middle Eastern and North African countries, a new burden, was another study that was done in 2010 by the World Journal of Gastroenterology. Celiac disease is now recognized as a common disorder among Middle Eastern and North African populations. I've included the recommended testing sheet in the podcast notes for any practitioner that wants to use them or for any patient that wants to take them to your practitioner. Please feel free to use that list of recommended labs. Everyone should have a baseline of their nutritional panel, and that's all listed out on that sheet as a newly diagnosed celiac patient, and then follow-up labs need to be done. And again, that's on a very individual basis and is up to the practitioner that is ordering those labs. If you are getting a test for celiac disease, I encourage everyone to get a total IgA and a total IgG, anti-tissue transglutaminase 2, 3, and 6 if you can, and that would be on the Cyrex lab Array 3, an EMA, endomyocele antibody. Look for an AGA or anti-gliadin antibody on the testing, and also a deaminated gliadin peptides. So a test should never just be a tissue transglutaminase. It is a puzzle that needs to be put together. And if you are positive for a tissue transglutaminase and an EMA or the endomyocele antibody, then you have gut damage somewhere. Keep in mind that there is up to 70% false negatives on the blood test, and there's a number of reasons for that. There's lab-to-lab variability. People can seroconvert at any time. The ranges are different for different labs, and the endoscopy is really no longer considered the gold standard, even by the celiac specialists. It's all a puzzle that needs to be put together, and everybody's an individual, and sometimes different labs need to be used for different patients. So I like LabCorp, or formerly known as Kimball Genetics, also Gluten Pro, which is in Canada, and TerraLab, which is in Texas, and they do stool analysis, which, by the way, are very accurate. And they also do a very nice test, which is called a fecal fat score. And they'll give a quantitative fecal fat score. So you'll actually get a number, which is fabulous information. It's considered that anybody with a fecal fat score under 300 is absorbing fat appropriately, as long as they're eating fat. But I deal with people with a fecal fat score of over 1,200, which means they're not absorbing fat and they can't absorb fat. So they really need to be tested further for celiac disease. The deficiencies we look at primarily are the fat-soluble vitamins, which are A, D, E, and K, calcium, and I also like to see a magnesium RBC, which is not a serum magnesium. I want to know how much magnesium is in the red blood cell. Zinc, iron, vitamin B complexes. So I like to see B12, B6 at least, a B9, and a B3. We do know that we're having antibiotic-resistant threats in the United States. The CDC did a great study in 2013 on antibiotic-resistant threats. I highly recommend that you look up the CDC information on the current information and data on antibiotic-resistant threats. Because if you have a damaged intestine, your immune system is damaged. 70 to 90% of your immune system is in your intestine. So if your intestines are damaged, so is your immune system. So we really have to work very hard at making sure our intestines are healthy and free of inflammation and our immune systems are working appropriately. So as healthcare providers, we all need to look at our environments where we see people. If you work in a hospital, please find out whether you can safely order a gluten-free food for your patients. And I do mean really look at it. Is there any cross-contamination? Do they even have a gluten-free menu? Do you allow outside food into the hospital so that patients' families can bring them safe food? Tube feedings absolutely have to be looked at for gluten, dairy, and soy, which are common ingredients and will kill people if you give a person with celiac disease anything that contains those ingredients. Is the food nutrient dense? Medications also have to be looked at and ordered to be gluten-free. Every pharmacist, their job is to make sure that the medications they are giving to people are safe for them. And one of the ways they need to do that is to guarantee that they are gluten-free before they are prescribed and handed out. And that includes over-the-counter medications. So let's go back to those questions. Diarrhea is the most common symptom. Really, only 15% of celiac patients have chronic diarrhea. Patients with celiac disease are underweight. 39% of celiac patients are overweight. Gluten must be ingested to affect celiac patients. Shampoos, cosmetics, and airborne gluten all affect patients with gluten intolerance and celiac disease. Celiac patients should be on a low-fat diet. A super good high-fat diet is essential for celiac patients. So make sure that you're referring your newly diagnosed celiac patients, or the ones that you suspect have non-celiac gluten sensitivity or celiac disease, to very well-educated nutritionists or RDs or people that understand about celiac disease and all of the healthcare issues that go along with it. If you're interested in finding practitioners in your area that you can talk to or that you can connect with, please go to primaldocs.com and look up that website. There are a list of worldwide practitioners that lay people and other practitioners can connect with that are practicing functional medicine or integrative medicine and also treating people with food and looking for the underlying cause of disease. You can also refer to my book, Donation, A Nurse's Memoir of Celiac Disease from Misdiagnosis to Food and Health Activism, for more information. I'm very honored to have Dr. Rodney Ford as the person that wrote the foreword for my book. So thank you, Rodney. If you have any questions, you can look up my website, glutenfreern.com. But really, thank you very much for listening to this longer podcast, specifically for healthcare providers. But really, I encourage anybody to have this information and to know that you're protected under the Americans with Disabilities Act and you have services that should be available to you. Testing is not hard, but if you have any questions, please feel free to email me or call me. And I am more than happy to come and do educational programs for clinics or hospitals, universities, anywhere. As I've said, I've given over 2,000 lectures on this, and I'm more than happy to come present this information to a group that needs to be educated. So thank you very much for joining me. The Gluten Free RN. This has been episode 31, where we've talked all about celiac disease for the healthcare providers. There's much more information to cover, but hopefully this will get you started on research and questioning and then testing your patients. And one of the very important things I've always recommended is that healthcare providers get tested for celiac disease themselves. Not just the healthcare providers, but their family and their friends, because we're out there. You don't have to look very hard to find us. Thank you very much for listening. I'm Nadine Griskoyak, the Gluten Free RN. Until next time, enjoy healthy food and stay healthy. Bye.